Welcome everyone to Should You Take That Case Expert Witness Edition. Usually, our show is used as a resource for legal professionals who pursue medical or medically related cases by sharing experiences and insights with attorneys as our guests. But today, it's all about experts and expert witnesses who are definitely a very important part of the litigation team. I am your host, Lisa Wade, legal nurse consultant, owner of Wade Nurse Consultants. But today, it's going to be all about our guest, Erin Glenn. And we're going to bring Erin out in just a moment. First, I just want to give everybody the opportunity, if you're catching us live or on the replay, to chime in to the comments section. Give an A if you're an attorney. Give LNC if you're another legal nurse consultant like me. But put an E if you're an expert or expert witness of any kind so we can see you and say hello. And I just want to thank everybody that is taking time out of their very busy days to give us a listen. I'm glad to have you. And now I'm going to bring out our guest for today. And she's going to introduce herself. Here we go. Legal nurse consultant, Erin Glenn. There you are, Erin. Hi, Erin.
Hey there, how's it going?
Oh, it's going well. Thank you. Thank you for being with us today.
Thank you very much for having me.
I want you to just introduce yourself to the folks. Tell us a little bit about you and your experience, your specialties, and let us know who you are, Erin.
So yeah, I've been a nurse since 2012. I graduated from Drexel University in Philadelphia, and I've worked in pretty much all of the critical care units you can think of, as well as some long-term acute care and procedural nursing, and a touch of care coordination.
Oh, well, that is excellent experience. So, tell us a little bit about how you discovered your passion for legal nurse consulting and what motivated you to pursue it.
Yeah, so this is about 6 or 7 years ago. My grandmother ended up having some really poor care, unfortunately, in a nursing home. After she passed, my mom called me a few months later and told me she was pursuing a medical malpractice case. I was not surprised at all after all the things she called and asked me about, if it was normal and all this stuff. So a few months later, she was on the phone with me giving me an update, and she said something about a legal nurse, and I just stopped and my whole world like shifted, and I was like, what is this? Completely changed the conversation. I was like, give me that attorney's name. I need to reach out to him. I need to learn more about what this is. And funny enough, I found it. I fell in love right away. I've always wanted to get into like forensics nursing. I always loved the law and make like putting all the puzzle pieces together. So it just kind of all aligned, and I started reaching out and working with an attorney. And ever since then, it's just been growing. I transitioned from part-time, still at the bedside, to making this a full-time business over the last year. So really exciting.
Oh, that is wonderful. Well, tell us a little bit about the what specific ways does what specific ways does your extensive nursing experience uniquely support attorneys in their cases?
Yeah, so as I mentioned, I kind of have a pretty diverse background. I didn't stay in one unit or do one thing my whole career. So it just gives me a really good overview of all of the care, especially with the critical care. So starting in long term, it really helps support patients with complex conditions, comorbidities, understanding the long term care aspect of cases. And then for the ICU cases, I have the medical surgical experience, cardiac, neurological trauma. So it really gives me a full perspective of different situations and scenarios, from anesthesia to sedation to ventilation to restraints, to name the disease. I've most likely worked with it. And if I haven't, I know who to ask. So it really helps me a lot see a full picture when I'm looking at these cases from the start to the end. And then working care coordination also helps me see like when patients should have been transferred, if it was an appropriate facility, and situations like that. So, and then with procedural, it really gave me an in-depth insight with anesthesia versus nursing sedation and what's safe and different aspects to that kind of care. For procedural, I worked it was in the hospital, but it was a day procedure. So it was for higher risk patients in case they needed to be transferred into the hospital. So that gave me a lot of insights into different like primary care things, because we did a lot of biopsies for cancer diagnoses and stuff like that. So I learned quite a bit about that field of nursing. So yeah.
Yeah, you do have an extensive experience, that's for sure. All right, so tell us a little bit about if you can share a
Mhm.
compelling case where your expertise as a legal nurse consultant played a pivotal role in achieving a successful outcome for that attorney and their client.
So I have not gotten like full feedback. Some of these cases really take a while. So a lot of them have not been completed. So I don't know what the resolution is. But like most recently, I was working with an attorney client who wanted, it was a delayed diagnosis case. And he wanted me to like look for symptoms that the doctors had missed. And I was going through the chart and there was nothing. It was a lung cancer case, which came on super quick. But through my research of going through the chart, I was able to identify this guy was a chronic smoker, and that he was smoking long enough, and he was in the age risk group that they should have done primary preventative screening, which was overlooked. So now we're switching the projective or lack of words, I'm sorry, the angle of the case, and we're going to go at it at a preventative care versus like missing symptoms. So another thing is like certification of merits, I think, are huge. One attorney wanted to pursue something telling me that the patient should have been restrained, which I was just like right away. But I looked through the chart. I wanted to evaluate it like objectively, right? Make sure like, should that patient have been restrained? I mean, can be a slippery slope as a nurse. I'm sure you're aware, but I don't know if attorneys are. There's a lot of things that we have to do before we can just implement restraints. And the staff did that. And I had to decline. And unfortunately, I don't like telling attorneys that, but at the same time, it's saving them a lot of resources and time and money and frustration for something that is going to be so hard to prove at the end of the day, when there was nothing negligent on the staff's end. It was just one of those things that happened, unfortunately. So.
Oh, yeah, restraints is definitely a slippery slope, like you mentioned. Yeah, yeah, you can't just tie folks down.
Nope. Nope. As much as some people may want that, that is not how it works. So.
Well, that's good. That's good that attorney had you to explain that to them for
Yeah.
sure. Now, tell us a little about some common misconceptions that attorneys may have about the role of legal nurse consultants, and how can you dispel those misconceptions?
Yeah. So I don't know exactly what attorneys are thinking, right? They're kind of tough shells to crack, straight to the point, all business, despite trying to break through and make that rapport a lot of the time. But one thing I have noticed is when reaching out and seeing if attorneys would like assistance, like take some of that workload off, save them some time, money, frustration, make sure they're not missing any aspects. I get a lot of feedback of, oh, like I like to do it myself. Oh, I send it overseas and get it for dollars on the penny. Oh, my paralegal does it. And that's great. And they're probably awesome at organizing and putting data together, but they're missing the analyzing aspect, which is huge, right? For a case, like we can help build deposition questions when we're going through, like what's the defense or the opposing counsel going to say, to go back at your claim. What is like that last case I was just speaking about, would they have picked up that there was a preventative care measure that was missed instead of just seeing there was no symptoms? So just that analyzing piece is quite huge, and a nurse brings a lot of value to that. And I don't think a lot of attorneys are aware of that. And I can't say that's like what they're thinking, but that's just kind of my perspective and what I've picked up through talking with
Mm.
some attorneys. So yeah.
Oh, I hear you. It is definitely an advantage to have a nurse who is reading about these policies and procedures, because a nurse has actually been there and done that. And that's a little different from a paralegal or an attorney going through those records. I see your point.
Yeah, exactly. So we just help bridge that like medical legal gap and really help bring those extra components in. So
That's right. And so tell us how you effectively communicate complex medical information to attorneys who may have a medical background,
who may have a medical background or
who
may
may
not.
not have a medical
Okay, I
background.
was like,
Excuse me.
I haven't worked with too many that do, although
Please,
there are
please
some
stay
out
careful.
there.
But tell us more.
A lot of the times, so different attorneys I've noticed have different ranges of medical knowledge. Some of them are like super knowledgeable, get it, and then some are more like talking to a patient. So my first thing is really assessing what the knowledge base is, and sometimes that can be challenging if they're not quite forward or they're speaking to me as if they know everything that's going on. But I try to gauge that. And then with my first 3 products, I always tell them to let me know, like, what would you want differently? What don't you understand? What do you understand? Let me go back and tweak it so then I can address like what your needs are, because everybody's knowledge base with the medical aspect is so different. So I do like an initial assessment on our phone call, try to gauge what their understanding of all these things are, of the medical aspects are, and then I'll make my first product, send it to them, and let them know if they want me to go back through it. I do that follow up free of charge, because that's my learning curve of getting to know them and really knowing how I need to communicate with them effectively and for their products. So,
Mhm. Well, assessment is the first tool in a nurse's toolkit. So
right.
assessing attorneys and what they know, it's just like assessing patients to find out what do they really know about what's going on, and that lets you know how to talk to them. You're good.
Thank
Right?
you.
Well, how about what advice, as we're winding up a little bit, what advice do you have for attorneys that are seeking to leverage the expertise of a legal nurse consultant to strengthen their cases and achieve those favorable outcomes?
Well, if you're not working with an LNC, I highly recommend it, not just because it's what I do, but because I think it will really support and affect and change the way you practice and see that you get that much more effective in your cases because you have that knowledge of that medical expert knowledge, like by your side, like behind the scenes, guiding your hand and making sure you're not overlooking any of those standard of care or negligent aspects of the case. And then also my big advice is, when you're first communicating with an LNC and like we're trying to do that assessment, like be open and honest with us and really like let us know what your base knowledge is and what you need, because I have worked with a few attorneys who weren't fully open, and like they read me this report and they're going through this stuff and I'm like, oh, they get it, they know what's going on, and then I send them something and they're like, this is so confusing, and I'm like, oh my gosh, I'm so sorry, I misread that conversation and like the questions I asked. So like since then every time I do it, I learn, right? And then I learn more questions to ask and all of that. But I also need them to be more open with me the first time, because then it can help me create a better product the first time around.
Oh, all right. Well, that is good information. And I just want to ask another quick question. When in a case do you think an attorney should get a legal nurse involved?
I say the sooner the better, because the sooner you find out those red flags, the better, right? Because there could be something in there, like you have a case, you know the story, and it's all there, and then there's just one thing in the chart that might be a red flag that could completely negate the case. Say a patient refuses, and it was just something that overlooked. I mean, I'm grasping at the most obvious thing right now, but we can just really identify things early on, to either tell you that you need to back away or that you need to build a strong offense or defense, whatever side that you're on, and help with that early. So prep
Well,
you for
I hear
trial or depot or wherever you're going. So
yeah, the sooner the better. As soon as that potential case hits the desk,
yeah.
to find out if a case is really a case.
Yes, exactly. I mean, I've definitely gotten cases where they're so far down the road and I'm picking up all these things. I'm like, I don't want to have to tell you this right now, but I do. So,
Oh, that's right. That's right. Well, if they want to hear the truth, they will definitely get in touch with you, Erin.
yes, very objective. Promise that.
All right. Well, like I said, we are winding up for today's episode. So I just want to find out if if you will let the folks know how to reach you, how to get in touch with you.
Yeah, so my email for work is for my legal nurse consulting business is ground control, GROUNDCONTROL at rn-consultant.com. Oh, thank you for putting that up there. I'm over here trying to memorize it. And or you can find me on LinkedIn and just direct message me there. And my phone number is 610-462-3899 for work.
All right. Excellent. I'm so glad that you were with us sharing all of your experience and abilities today. And thank you for coming.
Thank you so much for having me.
All
It's been
right.
a pleasure.
Well, I'm glad. Let's do this again.
Definitely.
All right. And thank you all for watching us today. I encourage you all to tune in for another episode of Should You Take That Case Expert Witness Edition. We'll see you later.